is the Emergency Medical Minute. All right, ready to go. It is what is today? Friday, Medical Minute. All right, this is not an earth-shattering medical minute, but kind of adds to our knowledge database. So yesterday I was doing a little teaching day before with one of our PA students that's rotating with us. So we were talking about our approach to the young patient with vaginal bleeding, which of course we all know we're hypersensitive to not ever missing an ectopic pregnancy. So I found a study. This is not like a giant New England Journal study, but it's in the Journal of Research in Medical Sciences from 2014, and it's basically an Iranian study where they were trying to identify risk factors for who is going to get an ectopic pregnancy. So they identified during a certain time period 83 women who had presented and were ultimately diagnosed with ectopic pregnancy, and compared those to 340 randomly selected women who just had a normal pregnancy, and tried to compare the characteristics to see what can we tease out who's at risk for ectopic. So any guess of what percentage of all pregnancies are felt to be ectopic?
2%.
Yeah, 2% is good. So it's like 1 to 2%, which feels a little high to me because I feel like it's somewhat rare that we diagnose an actual true ectopic, but that's kind of what the stats show. And what would you think are some of the major risk factors if, young patient, positive home pregnancy test, vaginal bleeding, and what makes us say for sure she's got an ectopic pregnancy? PID. Okay, so let's look at PID. So in their study, they found that PID, they actually did not find a statistically significant association between PID and ectopic pregnancy, but you should know that other studies have shown that your risk is anywhere from 2 to 10 times as much with PID. So yes, traditionally definitely thought to be a risk factor. What about other things?
History of PCOS.
What's that? PCOS. Okay, they didn't identify that one, but maybe. Endometriosis? No, not that one either. But that does, so history of an ectopic is a big one. Ding, ding, ding. That's like the biggest one. So overall, women who had had a previous ectopic were found to be 17 times higher risk of having an ectopic. And that actually goes up with the number. So if you've just had one prior ectopic, your odds ratio is about 3. And if you've had 2 prior ectopics, your odds ratio jumps up to 16. So that one is really high. Others, we said endometriosis. So interestingly, having previous abdominal surgery of any kind is often felt to be a risk factor for ectopic. And although that didn't bear out in this study, other studies have shown that you're 2 to 5 times as likely to have an ectopic just with any abdominal surgery, which is a little weird, right? Doesn't make sense. If you've had your gallbladder out, you should have an ectopic, but that's what the studies show. All right, anything else you can think of? So a couple other interesting ones to hit. Advanced maternal age. So this one may or may not hit home for a few people. What would we consider advanced maternal age? What would you call that? 32, 35. So in this study, they found that it was definitely a risk factor, and their cutoff was age 26.
What?
Yeah. So for women aged 27 to 32, 27 to 32, you were 4 times more likely to have an ectopic pregnancy. And if you were 33 to 38, you were 4 times as likely. And then if you were greater than 39, you had a 9-fold risk of ectopic pregnancy. So that one's a little painful. The clock is ticking on your ovaries, Jay. All right. Any other risk factors? IUD is one. We don't have to talk about the numbers on that one. Having had a previous termination of a pregnancy is one. Having lots of babies is not. Having fertility treatment is a risk factor for ectopic pregnancy. And then interestingly, cigarette smoking is also felt traditionally to be a risk factor for ectopic pregnancy. In this study, it didn't bear out. But they did find spousal cigarette smoking was a risk factor independently. You were twice as likely to have an ectopic pregnancy. So, how does this change our practice? Well, in some ways it doesn't change it a lot because we're still going to be looking for ectopic on anyone aged like 10 years old to 90 years old that presents with vaginal bleeding. Having said that, there are some important kind of educational opportunities for us in the realm of PID and also cigarette smoking that we can counsel our young healthy patients that this definitely will put them at risk for pregnancy complications. So, all right, that's it. Thanks.
Thanks, everybody.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.